Good morning, everyone. This is Che, and welcome to everyone who's joined this morning's webinar, Addressing the Urgent Needs of DC Area LGBTQ Youth Recommendations. Before I hand it over to Andrew Barnett of SMYAL, for one more time, and those who are just joining us, if you scroll your mouse to the top of your window, a toolbar will open, and there you can open a chat window, and that will be your way for sending us questions throughout this morning's presentation, and then we can get to that during our discussion period. And thanks again for joining us. And with no further ado, let me go ahead and introduce Andrew Barnett of SMYAL.
Good morning. Thank you all so much for taking the time to join us this morning for this webinar. We are really excited to share this information with you. As Che just mentioned, this is Andrew Barnett. I'm the Executive Director of SMYAL. For those of you who don't know, SMYAL, the Sexual Minority Youth Assistance League, is the only organization in the Metro DC area solely dedicated to supporting our community's lesbian, gay, bisexual, transgender, and questioning youth. Before we get started with the presentation, I'd like to also introduce our speakers for this morning and to thank them for joining us. You already heard from Che Rudel Tabasola from CRT Collaborations. Che opened CRT Collaborations in 2009 and has served a diverse range of clients, including the Our Families Count Partnership, DC Mobile Food Vendors Association, and the U.S. Census Bureau. Che also worked with SMYAL to implement this needs assessment and co-authored the report that we'll be discussing this morning. Next, we have Kelly Peterman, the Crisis Services Manager East for the Trevor Project, which is a national organization determined to end suicide among LGBTQ youth by providing life-saving and life-affirming resources, including a nationwide 24/7 crisis intervention lifeline, digital community, and advocacy and educational programs that create a safe, supportive, and positive environment for everyone. We're also joined by Adam Tenner, Executive Director of Metro Teen AIDS. Metro Teen AIDS is a community health organization dedicated to supporting young people in the fight against HIV/AIDS. Through education, support, and advocacy, MTA works to prevent the spread of HIV, promote responsible decision-making, and improve the quality of life for young people infected with or affected by HIV/AIDS. We're going to go ahead and get started, but before we do, I want to lay out a brief agenda for this morning. First, Che and I will be going over the findings of SMYAL's new community report, addressing the urgent needs of DC area LGBTQ youth. We'll then be asking each of our speakers for their thoughts on the findings and how they relate to their work with local young people and LGBTQ youth all over. After that, we'll be opening the panel up to discussion and questions from the audience. If questions occur to you at any point, please feel free to send them to Chair or myself via private chat, and we will address them when we get into that portion of the program. So before we launch into the information we discovered, I want to give a brief introduction to the needs assessment process that SMYAL went through to get to this report. In 2010, we undertook this project as a way to survey the current needs of local LGBTQ youth in the DC metro area. Over the past few years, the LGBT community has made major strides in its visibility and in the legal protections available to it. LGBT individuals and issues are now discussed in the media in a way that we've never seen before, and new legislation has given the LGBT community legal recognition that was also not seen just a few years ago. We need only look at TV programs like Glee and personalities like Ellen to see how LGBT issues are being shown on the national stage. And here in DC, we have a number of protections for LGBT people, including beginning last year, same-sex couples are now permitted to marry. This has definitely impacted the lives of LGBT youth, and we have seen a rise in LGBT youth coming out earlier than ever before, and a proliferation of gay-straight alliances in local schools. At the same time, many of the issues which have negatively impacted LGBT youth since SMYAL's founding persist, ranging from bullying in schools to risk for HIV/AIDS infection. New technology and trends in popular culture have also created new risks, such as the new issue of cyberbullying. The purpose of our needs assessment was to analyze how these trends and changes have affected LGBTQ youth in our community. We did so by conducting a literature review of recent studies with data about LGBTQ youth, and also implemented a series of focus groups with LGBTQ youth from this area. In order to ensure we were capturing as inclusive a picture as possible, we targeted subpopulations through focus groups specifically for young lesbian and bisexual women, young transgender women, young men, and youth living in the suburbs. Analyzing the available data alongside the results of our focus groups painted a complex picture of the needs of LGBTQ youth. and how those needs do and do not always line up with the perceived needs of those young people. Based on this information, we've recommended a series of actions local stakeholders and community partners can take to help address the urgent needs facing this underserved population. I'm now going to hand the presentation back over to Che, who's going to walk us through the recommendations and the data that led to them.
Thank you, Andrew. For those of you who have the opportunity to see the report, we arrived at 8 different recommendations. And we've organized this morning's presentation in terms of showing you the recommendations and then sort of backing out from that and explaining the data and how we arrived at those conclusions. And the first recommendation is we need to build capacity to serve LGBTQ youth who are homeless. We need to build local capacity to serve homeless LGBTQ youth by expanding culturally competent emergency shelters, transitional housing programs, and homeless prevention centers for LGBTQ youth. One of the studies we looked at was a 2010 report from the Center for American Progress that was a national data set about homeless LGBTQ youth, and it demonstrated the incredible challenges that they face. LGBTQ youth make up a disproportionate percentage of the national homeless youth population, in part due to youth identifying as LGBT or Q at earlier ages when they depend on their families to meet their needs and are particularly vulnerable to rejection. Homelessness has immediate consequences for LGBTQ youth, including placing them at risk for attempting suicide and engaging in survival sex, the trading of sex for food, shelter, or other materials. Long-term consequences include reducing the youth's economic trajectory. The CAP report highlights the dearth of programs and protections for LGBTQ youth who are homeless, including limited federal assistance for housing programs for youth and a lack of regulations ensuring providers are culturally competent to serve LGBTQ youth. During our focus groups, a central theme was this issue of housing and services for homeless youth. Youth reported unstable living situations caused not only by disapproving and abusive families, but also by the lack of affordable housing in their own communities, financially overwhelmed parents, or foster care or group home placements that are not LGBTQ or more affirming or welcoming. In the DC metro area in particular, only one facility provides dedicated transitional living beds for LGBTQ youth, and there are no dedicated emergency beds for this population. When LGBTQ youth do obtain placements in these facilities, they often experience harassment, discrimination, and even violence from other youth. They also report a lack of cultural competency from some agency staff members. Youth who are transgender are often housed according to their biological sex, despite their gender expression, forcing them to either hide their gender identity or open themselves to abuse and violence from other youth living in the facility. Our second recommendation was that we need to educate schools and community service providers about LGBTQ youth populations to ensure that schools and community spaces are safe and affirming for LGBTQ youth. Whether it's school or interacting with city social services, the majority of LGBTQ youth's experiences are with groups and institutions that are ill-prepared or unequipped to serve them. Community organizations that provide essential services to youth must ensure that staff is culturally competent and that their programs are safe and affirming spaces for LGBTQ youth, who are often among those in greatest need. Schools where LGBTQ youth are dramatically more likely to experience violence than their classmates, especially are in need of education so that LGBTQ students can have the same opportunities as others. One of the studies we looked at was the Youth Risk Behavior Survey of Washington, D.C. public high school students, and this is from the 2007 study. It found that 37% of LGBTQ youth report being bullied. Now you see there's an asterisk there. The Youth Risk Behavior Survey doesn't ask about gender identity, and so the following data set is only for students who identified as LGB or Q. Coming back to the data, 23% report being threatened or injured with a weapon. 47% of LGBTQ students report having property stolen or deliberately damaged. These numbers are much higher when you compare them to their heterosexual classmates. And when you look at those figures, 15% report being bullied, 9% report being threatened or injured with a weapon, and 24% report having property stolen or deliberately damaged. Continuing with the Youth Risk Behavior Survey, found that 28% of LGBTQ students said that they had stayed home from school because they felt unsafe, as opposed to 12% of heterosexual students who had stayed home for the same reason. One of the things we found was that LGBTQ young men in particular are at a high risk for violence. The survey found that 51% of LGBTQ males report being bullied, 38% of LGBTQ males report being threatened or injured with a weapon, and 54% of LGBTQ males report having property stolen or deliberately damaged. Transgender youth are especially high risk to suffer violence. And here we took a look at a report from the Gay, Lesbian, and Straight Education Network of transgender students nationwide, and we found that 89% of transgender students report being verbally harassed because of their sexual orientation. 87% of transgender students report being verbally harassed because of their gender expression. 55% of transgender students report being physically harassed in school because of sexual orientation, and 53% of transgender students report being physically harassed in school because of their gender expression. Recommendation number 3. We need to build programs that speak to the intersection of identities. We found that when we spoke with youth, LGBTQ youth have multiple identities, and programs must be built to speak to the intersection of these identities and reflect the multiculturalism of the local LGBTQ youth population. The needs of LGBTQ youth are shaped by a complex intersection of sexual, gender, racial, and ethnic identities, as well as by the economics of living in Washington, D.C., where 2 in 5 African American children live in poverty. For focus group participants, economic needs were paramount above all others. Discussions focused on tangible commodities services, such as housing. Participants spoke little about long-standing LGBTQ issues, such as coming out. One of the most urgent needs for LGBTQ youth is education and job training. LGBTQ youth looking for employment in the D.C. metro area are entering into a highly educated, highly skilled job market, but few resources for housing or jobs specifically reach out to LGBTQ youth. Effective LGBTQ youth services must address all of youth's identities, not just one. Youth programs must build services that are culturally competent to work with diverse populations, foster spaces that celebrate multiculturalism, and ensure outreach to populations that are the most underserved. For an LGBTQ youth serving organization to not work at this intersection of identities is to risk leaving out those who are in most need. This rule also holds true for organizations that serve the general population. Recommendation number 4. Expand HIV and AIDS prevention, education, testing, and services. HIV and AIDS prevention, education, and testing services and care for youth living with HIV and AIDS must be expanded in the suburbs as well as the district and include culturally competent and relevant information for LGBTQ youth populations. There's a critical need for this education and outreach in the suburbs surrounding Washington, D.C., as well as in the district. We took a look at a study in the suburbs surrounding Washington, D.C., and found that 46% of people with AIDS in the Washington metropolitan area live in the Maryland and Virginia suburbs. However, the report from the Washington AIDS Partnership found that suburban HIV outreach is underfunded and lacks coordination. In school, HIV education varies widely, and it's rarely comprehensive. Condoms can eliminate or reduce the risk of spraying HIV during sex. However, just 3 schools in the district suburbs provide live or video demonstrations for applying condoms, and 2 systems ban any condoms at all from being brought on the school grounds. Within the district, 3% of district residents have HIV or AIDS, the highest figure in the nation. That's from a Department of Health study. While rates of infection have increased among nearly every population and age group, African Americans are struck hardest. More than 75% of district residents who have contracted the virus are African American. A study by the Department of Health found young gay and bisexual men continue to report infection rates that far exceed the general population, and the majority of youth who are diagnosed with HIV